So let's make a start. So my name is Denise. I mean, I have the longest name in the world. I have to pick one, so Denise is fine. So Denise Pessoa. I am the Associate Lead for Therapies and the Professional Lead for Occupational Therapy at the Royal Marsden Hospital. And I work cross-site. We have two branches, Sutton and London, and I work across the two branches. And we're going to be talking about fatigue management, which is a huge part of the work that I do as an occupational therapist. I'm not entirely sure if you've already seen any occupational therapists in your treating hospitals. You should have, but if not, occupational therapists are professionals that deal with rehabilitation, and we try to make sure that people can do usual activities as well as they used to do before. So in terms of if you have any mobility problems, if you have fatigue, cancer causes a lot of problems, as you well know. So we try to make sure that we try to help people achieve what is important for them. So I'm going to start off by just proposing a few items or objectives and goals that I want to achieve today. So I want to define cancer-related fatigue, so we're going to talk about what it is, and I want to demystify some things about it as well, explore links between fatigue and occupational therapy interventions, and also provide some strategies and practical tools for you to be able to manage fatigue. So I'd like to start off this talk by using a definition of what cancer-related fatigue is. And I like to highlight the words that I think are most important in this definition. And I kind of realized that I highlighted the whole definition. But what I want to break down this definition with you and talk about the specific points in it. So cancer-related fatigue is described as a distressing, persistent, subjective sense of physical, emotional, and cognitive tiredness or exhaustion, which can be related to cancer or cancer treatment, and it's not proportional with recent activity, and it interferes with usual functioning. So if you think about this definition, can I just get a brief show of hands of if you've experienced that before or not? Yes? So probably all of you have been through that, and you probably think about this definition and think that one or two or three or four or all of the words kind of apply to what you have experienced. So what I like to talk about is the fact that fatigue is not only distressing but persistent. So what is this persistence with fatigue? So it means that it's always there. It seems like it doesn't go away. The other thing that I like to talk about when I talk about how persistent it is that it doesn't matter how much or how well you slept last night. You might wake up today and feel really tired and feel like, oh, actually, I can't really do the normal activities that I would do on a daily basis. So it's really important for us to acknowledge that, because most times when I speak to patients, they feel like they're the only ones going through that. So they feel, I feel like I'm just getting lazy. I feel like, I'm really let cancer defeat me. And we then as healthcare professionals need to sit down with this patient and say, hang on a second, if you look at the definition of what cancer-related fatigue is, you're going to notice that it is persistent. It is distressing. So if you're crying with exhaustion because you can't do the things that you used to do on a daily basis, you're not alone. The definition says that it's distressing, right? So it's distressing, it's persistent, and it's subjective. So subjective means you and only you know how badly it affects you. Yes? So what is something objective? Objective is yes or no. It's black and white. Yes? Subjective means it doesn't matter that you can run for 30 minutes and feel perfectly fine to do your activities. I am not able to do that, and that's okay, right? So we're talking here about what fatigue is for one person might be different from what fatigue is for another person. Okay, so that is subjective. And so these are the three main characteristics of cancer-related fatigue that are very different from normal tiredness. Right? And what I like to talk about as well is that it's a physical, emotional and cognitive tiredness. Because sometimes when we think about tiredness, we only think about the physical aspect of tiredness. Oh, I want to, sit on my sofa. I can't really get up. I don't want to move. I don't want to go anywhere. However, we normally identify that sometimes fatigue can present as like an emotional tiredness. Sometimes you're not able to cope with difficult news. You're not able to cope with another problem going on in your family, for example, or you're not able to cope with stress at work. So this is the emotional and the cognitive tiredness as well. And sometimes I like to focus on the cognitive aspect of tiredness because some patients come up to me and say, I just feel like I'm forgetting things. I feel like I just feel like I go to the shops and I had a list in my head, but then I go there and I forget if I'm meant to buy milk, and then of course by the time I get home I remember that I forgot shower gel, and then so the cognitive aspect of tiredness is also very, very important, and it can be very, very limiting and very debilitating as well. So I like to talk about that, and we'll talk about that in the next slide. And then the other important part of this definition is that it's not proportional to recent activity. So it doesn't matter, as I said before, so it doesn't matter what you've done before. You might feel tired because you have cancer, because you've gone through cancer treatment. So it's not necessarily proportional to yesterday I worked a lot, or yesterday I moved houses, for example. So it's not necessarily proportional, and it does interfere with usual functioning. What's your usual functioning? What are the things that we do on a daily basis? We have showers, we look after our personal care, so showering, getting dressed, brushing your teeth, brushing your hair, putting shoes on, putting clothes on, getting back home. So what are the domestic usual functioning activities that we normally do? We cook, we clean the house, we try to organize things, keep everything tidy. So if you think that for some reason you're not able to do these activities that are just your personal and your domestic daily activities, that is normal. It is within the definition. It does interfere with your usual way of functioning. So fatigue is highly prevalent, and it's not highly prevalent only during treatment, because I think everyone expects, and normally your medical teams might have told you, oh, you're going to feel really tired when you go through chemo, for example. However, a lot of patients come back to me and they say, oh, what I didn't realize is that I'm 6 months post-treatment and I still can't do the things that I used to do before, because it is very persistent and it can be present both during and after treatment. So what I want to demystify today is that fatigue is not laziness. It's not up to you, right? It's not a choice whether you can or can't do things. So you're not lazy because you have fatigue. It doesn't necessarily improve with sleep or rest, because improving with sleep or rest these are the methods that we normally use to treat normal tiredness, isn't it? Oh, just have a rest, just have a sleep and you'll be fine. And it's not the case with cancer-related fatigue. And it doesn't improve automatically after the end of treatment. So it might be that after months or even years, you're still feeling tired, you're still feeling like you're not the same person as before. And it is, as I said, debilitating and it affects all areas of function. So when we think about what does fatigue look like? So what are the things that you might experience? And I love, I don't know if, are you all patients, or any relatives here? I love saying this to relatives, because relatives, it's difficult. Sometimes they can't understand what patients go through. And anyway, you have your slides. Make sure you just drop it unintentionally near a family member so that they can recognize the signs of fatigue as well. Because as I said, there's hidden signs of fatigue. The ones that we can see are normally the physical signs of fatigue. But we need to understand that fatigue is very, very broad. So fatigue might look like lack of interest and drive and ability to engage in normal activities, as we talked about. But it can also present as mood swings and irritability. So sometimes this emotional aspects and being really irritable, being really short, sometimes that can be a sign of fatigue as well. Sleeping a lot might be a sign that you are tired, and normally say, oh, now she needs to have a nap during lunchtime, or she sleeps for 10 hours a night and she's still tired. So sleepiness is a very, very traditional sign of fatigue. But what sometimes is not talked about too much is that lack of sleep and insomnia can also be a sign that you're tired. Yes? Memory problems. So now we're talking about all the cognitive aspects of fatigue. Feeling like sometimes you're talking and you forget the words. Oh, what is that thing called again? I can see some smiles. Yes. What is that thing called again? Or sometimes you're talking about something and then something happens or nothing happens and you completely lose your train of thought. So that is a cognitive aspect of fatigue, a cognitive symptom of fatigue as well. Difficulties concentrating or paying attention. So sometimes you're paying attention to me, but your mind might be going to other places. You might not be able to focus on something for a very long period of time. And difficulties with making decisions. And sometimes difficulties making decisions can be so stressful, and I want to acknowledge that. Sometimes it is even decisions such as, should we go out today or should we stay at home and have something to eat here? And then, sometimes, then just considering the options and the pros and cons and whether you're going to have energy to do that or energy to stay at home, but then what does that entail? Are we going to be doing this? Are we going to be doing that? And then just this difficulty making a decision can also be a sign of fatigue. And I really wanted to acknowledge that. Well, the reason why I'm here is I want to provide you with some tools to try to manage all of these aspects. Unfortunately, we don't have a pill to cure fatigue. I wish we had. There are some trials happening at the moment. There's no conclusive results yet, but there are some trials looking at whether some drugs might work to improve fatigue or to actually try to reduce the symptoms of fatigue. But nothing has been confirmed yet in terms of drugs or other sorts of treatments. So what we can do is we can manage fatigue. Yes, so we can't completely remove it from our lives, but we have some strategies and some things that we can do just to try to live a little bit better with fatigue. And I normally call them the 5 P's of energy conservation because all of them are P's. You have these slides in your pack, so you don't need to take notes. It would be useful to have them and to just go through them after this talk to see what you can implement in your daily living. So I'm going to be talking about each of them specifically. So they are planning, prioritizing, pacing, positioning, and permission. And I'm going to be talking about them right now. So planning is actually planning, right? There's no secret to planning. So plan is to actually write down. Sometimes when we plan things in our head, things can become a little bit loose, right? So when we write things down, our thoughts become a little bit more concrete. So it's nice to write down the activities that you plan for the day. So today I have the Ovacome event the whole day, then I'm going back home. There's someone who's going to come for dinner, and then I have to try to have an early night because on Sunday I'm going to be walking the dog and I have another family event or something like that. So try to really write it down, write the activities that you plan for the day, and try to estimate how much energy is that going to take. So you might have thought to yourselves, oh, I'm going to attend this event today and it's going to be fine. So I'm going to be sitting down and I'm going to be listening to people. But remember that I talked about the cognitive aspects of fatigue. So when you spend a lot of time focusing on something or maintaining conversations or a lot of time just really, really highly aware of your environment, of other people, that demands a lot of energy as well. So normally I tell my patients, try to estimate, is that going to be tiring? Are you going to be demanding a lot from your cognition or from your physical abilities? Are you going to be out on your feet all day? So try to estimate how much energy these activities will demand. And then also try to take into consideration, as I said, if you're going to be reading or paying attention or holding conversations, that might use up a lot more energy than you actually thought you would use. Yes, sometimes we tend to take it for granted because you say, oh, but before I had treatment, I used to do it and I didn't feel tired. I could do 3 of them in the same day. But now we need to think about how we use very, very smartly our reserves of energy. Okay? And then we talk about after you've planned the activities that you have and you've written them down, try to use prioritization. So what is the most important thing of that day? If you could only choose one, what would it be? And also, try to think, what are the activities that are completely non-negotiable? I have to do it. I have a doctor appointment tomorrow morning. That one I have to attend. It doesn't matter that it's a 1 hour drive to go, 1 hour drive to come back, stressful to find parking, stressful to be sitting down while my doctor is running late. That demands a lot of energy, and it's the one activity that you cannot miss on that day because it's a doctor's appointment. So if you think that you have that, and you have several other things that you need to do on that day. Oh, my house looks, my house is a mess. I really need to organize everything. I haven't hoovered the house in 2 weeks. Okay, what is the negotiable and what is the non-negotiable here? If you could choose only one of them, what would it be? And always try to think of energy as, because it is a limited resource, right? So it's a little pot, and the more you use it, the less you have. And you're only going to fill that pot if you rest, if you take breaks, and if you allow yourself enough time for your body to recover. Okay? So try to think that your reserves are limited, so we have to try to use them very, very, very smartly. And I also mentioned the motivation matters. So the more involved you are in an activity, if it's something that you really want to do, you might find it a little bit easier to cope. So normally I always say cleaning the house because that's what I spend most of my time doing, but it might be that motivation for cleaning the house is not as high. So really try to prioritize the things that really, really matter to you. And we're going to talk about delegating activities afterwards. That's why I wish some relatives were here to listen to that as well, because we like to delegate things to them. So we're going to talk about pacing, which is the third P in energy conservation. So pacing is what, for me, is one of the most important, most precious P's of the strategies. And why is that? Because when you pace yourself, it means that you allow time or enough time to do activities that you need to do. Oh, but Denise, I used to clean my house in 2 hours. The whole house would be done. It would be sparkly clean. And now, after 1 hour, I haven't finished even the living room. And, and I already feel exhausted. That's fine. That's okay. What we're talking about here, when we talk about pacing, is actually taking your time to do the activity. It doesn't mean that because you used to rush to do things before and get everything done, that things are going to remain the same. So allow yourself as much time as it takes to do activities, the time that it takes for you to cook or to prepare something to eat, the time that it takes for you to have a shower. So things take the time they take. If it takes longer now than it used to take before, that's okay. It's just different. Yes, try to allow yourself time for that. If it used to take you 15 minutes, now just plan yourself for half an hour. Why not? Yes, that is your time, and it's very precious, and you need to use it in a way that favors yourself. And I also talk about taking regular breaks when doing activities. So not only taking your time, but when you're doing something that requires that will take probably most of your day or a lot of time, try to make sure that you add some breaks within the activity. So I found it really sweet when I was listening to the introduction and to the house rules. So what have they mentioned about the environment? There's some sofas there. Why do they say that? Is it just because it's nice and posh to have sofas around? No, because it's actually important for you to take breaks, for you to sit down somewhere comfortable. Try to give your brain some space as well, right? So important for you to alternate periods of activity and periods of rest. Periods of activity and periods of rest. And why do I say that? Because if we think about a marathon, right? If you think about a marathon, you spend a lot of time burning your energy. What happens after the marathon is finished is that person I don't know because I've never run a marathon, but that person probably is not able to do anything for the rest of the day because they used up all of their energy. So instead of using everything at once and then not having energy to do anything for the rest of the day, we can do bits of activity and have periods of rest. bits of activity and periods of rest. Bits of activity and periods of rest. So in that way, we're being clever about how we use our reserves, because when we try to rest for a little bit, we restore a little bit of energy and then do a bit more activity, and then restore again and then do a bit more. Yes? So that means maybe if you go out for a walk, you can go out for a walk for 10 minutes, 15 minutes, then have a sit down, have a drink. Yes? Spend some time. So I will talk about positioning in the next slide, but try to take the energy, just try to save the energy on the areas that you can save energy. So standing up, for example, I'm using a lot of energy when I'm standing up. If you sit down, then it means that your body's using less energy, and I'll talk about it in the next slide. And always try to keep in mind the hidden signs of fatigue. Remember, fatigue is not only physical, but it's cognitive as well. If you realize that during that day you're starting to get very moody, you're starting to get a bit irritable, or you're starting to forget words, that means that you're tired. So that is a sign for you that it might be time for me to have a rest. Yes, I can't keep doing this, because otherwise I'm not going to be able to do something for the rest of my day. So try to use your energy very, very sparingly. So positioning is also very important. So when you're standing up, which is the position that we normally have for doing most of the things in our day, we spend a lot of energy, because I'm using my abdominal muscles to keep my trunk up, my back muscles to keep my trunk up, I'm using all my leg muscles to stand, I'm using my head muscles as well to keep my head in place. And even though you're not doing any activity that your heart is racing, yes, not physical activity or exercise that your mind is racing, you are spending a lot of energy. That's why normally when we have talks, for example, that last 40 minutes, people sit down to listen to it, right? Because it's not common. If you go to the cinema, you're going to be sitting down. You're not going to be standing up. So standing up uses up a lot of energy, and we cannot underestimate how much energy that uses. Sometimes, but I didn't do anything. Oh yes, you did. You stood up for half an hour. How come you didn't do anything? Yeah, sometimes if you can't find a place on the train, for example, and you have to stand up all the way from Croydon to Victoria, come on, that's a lot of time as well. So remember that standing up will use up a lot of energy. So normally when I say sitting down saves your energy. So I'm just going to sit here on the side. So if I'm sitting here, my legs are not supporting the weight of my body anymore, right? However, if you look at my trunk, my abdominal muscles and my back muscles are still supporting my body. So what can I do to save energy even more in this position? Rest back, right? So if I rest back, now my legs are not using much energy. My abdominal muscles and my trunk are not using any energy. What else could I be doing to be even more comfortable when I'm sitting down? Headrest. So if I had a headrest, then my neck wouldn't have to be supporting the weight of my head. What about my shoulders? Armrest. So if I have an armrest, or if I have a cushion over here that I can rest my arms on, then I'll be more comfortable. So normally when we think about positioning, it's every step of the position, right? So if we're sitting down, we're resting our legs. If we're resting back, we're resting our trunk. If we have somewhere to rest our arms, we have some arm support. If we have a headrest, we have neck support as well. And the less muscles you use to maintain your position straight, the more energy you're saving. And I like to talk about that, because people will then say, well, Denise, but of course, I can't lie down all day, because what can you do? What can you achieve when you're lying down? And I'm not talking about lying down, but I'm talking about maybe if we can use, remember the little pot? So remember that if I can save some energy from my pot in my positioning, I can use that energy to use the activities that matter to me. Right? Or I can stay a little bit more time doing that activity. So I normally say that's why I asked in the beginning, have you met any occupational therapists in your treating hospitals? Because they can give you some advice about that. And I'm going to show you some bits of equipment that I normally advise my patients to have while they're having treatment. So some things that patients tell me, Denise, having a shower is completely exhausting to me. I find it really hard. I find that it drains all my energy. By the time I finish having a shower, I don't feel I have energy to grab the towel and dry myself, let alone put my clothes on. A lot of patients say that to me, and you might identify with that thought. After I have a shower, I have to have a lie down before I put my clothes on. Don't know if you've ever experienced that. But what I normally suggest to patients who come up with this kind of problems to me, I normally suggest some adaptations that you can use in your shower or in your bath at home. So if you have a shower, so I don't have the pictures for the shower, but if you have a shower and you can have one of those flipping, it's like a flip-up wall-mounted shower chairs. So the shower chairs, normally they don't have a lot of support. They might only have the support for you to sit. Some of them will have arm support. But you're saving the energy from your legs by sitting down while you're having a shower. If you have a bath, then you can use either a shower board, do any of you have one of these at home? No? So you can use a shower board. So a shower board sits across the bath, so you can sit here while you use the shower head to wash yourself. So the only issue I find with the shower board is that it doesn't have any back support. So you're a little bit vulnerable but some people, all they need is just a little perch, right? So you might not need to use that for your whole shower. So that's why I say the shower board is a nice option for a lot of patients. If you feel like that is not giving you enough support, you can have a swivel bathing chair. So what happens is this swivels across, so you can unlock it, and it sits over here at the edge of the bath. You sit down and you swing your legs across inside the bath. So this is a bit of equipment that helps with transfers in and out of the bath. If you can't do this, if you can't do hip flexion in order to swing your legs inside the bath. So that can help you with that as well. But it also saves a significant amount of energy because you're sitting and having a bit of a rest while you're having a shower. And that might allow you to have a shower for a little bit longer, or that might allow you to complete shower after drying yourself and putting your clothes on. Yes? Of course, having breaks, as I said in pacing, so having breaks is very important, and sometimes you actually need a lie down after you have your shower before you put your clothes on. And just know that it's okay. You're not alone. If you have done it before, you're one of us, and if you haven't done it but you feel like doing it, that's okay to give it a try as well. Okay, this is a perching stool. You probably have seen it before. I love this bit of equipment. This is also something that an occupational therapist can prescribe, advise to you. So a perching stool is nice because it has back support, it has the arm support, and it's height adjustable. So a lot of patients find that they have a lot of difficulties finishing cooking, for example. Oh, I was able to cook a whole meal, but now I can only, put something in the microwave or make a drink or make a sandwich because I can't really stand for a long period of time cooking. And sometimes what I say, well, let's say that your kitchen has a worktop, and which is approximately this height. If you have a perching stool, you can adjust the height, so you can just perch on that stool while you do some activities, while you do chopping, while you do washing up, or while you, prepare batter for a cake, for example. So if you have a bit of a setup where you can fit something like this, it's actually quite versatile and it can help you in a lot of different activities. I normally say cooking or baking cakes, for example. This can be quite versatile in the kitchen, but also in your bedroom or in your bathroom after you finished your shower. You can use that while you're dressing, so it can help you with energy conservation as well. I like talking about wheelchairs, but I find that wheelchairs are normally a very controversial topic because normally when people look at wheelchairs, they say wheelchairs are for people who cannot walk. And me as an occupational therapist that work with patients who have extreme fatigue, I say actually wheelchairs allow you to go further even when you can walk. So normally we prescribe wheelchairs, or we recommend the use of wheelchair for longer distances. So let's say, for example, one activity that patients tell me that is really hard for them to complete is shopping. Especially if you live near like a Tesco Extra or something, and then you need to, so milk is in this aisle, and then you ask the lady, oh, where can I find eggs? Oh, that's in aisle number 24. Like, oh goodness, so you have to walk across the whole shop, and oh, where are the vegetables again? And then they're all across the other side of the shops. Walking around in a supermarket can be really, really tiring. Not only because you have to walk around, but because you have to pay attention at where things are. So you need to look, you need to say, oh no, actually I've been here before, I didn't find what I was looking for, I need to go to the other aisle, I need to find this and that. So wheelchairs can be particularly helpful for when we go shopping. And why is that? Because if you go shopping with someone else, and this person can help push you while you're shopping, you can actually make your life easier if you have that second person to go with you, or if you can self-propel the wheelchair so you have a little bit more independence. If we're not thinking about shopping, but we're thinking, for example, of a day out in the park, it might be that you say, actually, I'm not even going to go, because what's the point? I'm going to go, and after 15 minutes I'm going to be tired, and then I'm going to want to head back, so what's the point? So normally what I say is, what you can use the wheelchair for as well is to give you that extra support. Remember, positioning is very important. So if I have a wheelchair here and I'm walking around, I can support myself on the wheelchair while I wheel the chair around. So you're taking some weight off your body and putting that on the wheelchair. So you don't need to be sitting on the wheelchair. You can use the wheelchair as a walker, as a way to support part of your weight. And then if you feel too tired, then you use the wheelchair for its purpose. So then you can sit down and you can ask for someone to push you, or you can propel yourself. I find, and as I said, I find the topic of wheelchairs very controversial, because I think there's a lot of stigma around wheelchairs. I don't want to be seen in a wheelchair because it will mean that people will think that I cannot walk, or people will feel sorry for me. And sometimes thinking about the wheelchair, I say, well, but if the wheelchair is actually enabling you to do something rather than keeping you at home, why not try that? It doesn't matter what people think. Yes? So try to think about that, and whether or not you feel like some of these bits of equipment can be incorporated in your day-to-day. And the other one is permission. I find permission one of the most amazing, but one of the hardest things when we talk about energy conservation. And why is that? Because I'm telling you, or I'm asking you, or suggesting, that you give yourself permission to be helped by someone else. Now, if I can have a show of hands, and if you can tell me if you feel comfortable asking for help to other people. Oh, I can't, I used to do that, but I can't now because I'm too tired. I'm going to ask, how do you feel about asking for help? If you don't feel comfortable, please raise your hands. Okay, so some people feel comfortable, a lot of them don't feel comfortable. Now, if I told you today, ladies, I am struggling to do something. Can you please help me? Would you think that what would you think of me? Would you think any less of me because I'm asking for help? No? So do you think that when you ask for help, people actually think less of you sometimes? Yeah. So I think when we talk about permission, I think communication is very important, isn't it? And normally I go on and on and on about the disabled badge. And I say, well, and I have a very, very close friend of mine who says, yeah, sometimes people look at you weird when you get out of the car and you're using a disabled badge, but you get out of the car and you walk. So, well, what people should know, and this is why I'm here, to try to raise awareness of fatigue, raise awareness that fatigue can, that you don't necessarily need to have something visible for us to say, oh, that person is struggling, or that person doesn't have, cannot do or needs help. And this is absolutely important, and that's why part of my mission is to try to make sure that the more we can spread the word about people can be struggling without that necessarily being visible, the more we can get help. And it is true, sometimes, and that's why I say that when we talk about permission, communication is very important, because it is about having sometimes the confidence to say, I cannot do it. And it's not about what and I think sometimes when the other person cannot see what we are experiencing, sometimes it needs to be told, it needs to be explained, isn't it? I cannot do that because I'm having a bad day. I go through cancer treatment. Yes, and I think that's when you start to raise awareness of the condition. And as you said, I think most of the times when you have people who are close to you and they understand what you're going through, sometimes it's easier to get that permission, isn't it? The permission to not do something, or that permission to rest, or that permission to ask for help. And I think that I normally like to talk very much about this because we are very used to being super independent, and then suddenly after treatment or during treatment we just can't. We need help, and it's all about trying to think of the other side. Yes, so what is it like to be on the receiving end of that? So if I ask for help, in my head I am thinking that they will think that I am X, Y, and Z, right? But when we flip it around and we say, how would you feel if someone else asked for help? Would you actually think that these thoughts are true, that these concepts of people are necessarily true? Oh, is it if someone is asking for help, would you think, oh, they're asking me for help because they're lazy? No, you might think they're going through something that I cannot see, but if they're asking for help, they're asking for help. So permission is actually the last P for energy conservation. And I actually just have two more things to tell you about, which are two other tips for energy conservation. And it is physical activity. Some of you will look at me going like, Denise, come on, you're just talking about sitting down, taking breaks, taking it slow, and now you're talking about physical activity. And I highlighted in this presentation in red that physical activity is not necessarily exercise. It can be, but it's not necessarily. So exercise is anything that is prescriptive, repetitive, sometimes even a bit boring, right? When we talk about physical activity, we're talking about any activity that uses up some energy, some physical energy, that mobilizes physical energy throughout your day. Sometimes getting up to have a shower, standing up, is physical activity, can be considered physical activity. Something that's a little bit more pleasant, for example, taking the dog for a walk around the block, that's physical activity as well. So we're talking about anything, maybe going out and having a stretch, maybe going swimming, or you don't even need to go swimming, just staying in the swimming pool, walking around in the swimming pool is probably enough physical activity that mobilizes some energy. So mobility and physical energy. And try to choose activities that are pleasant to you. Try to choose activities that really, really matter to you, right? Because sometimes if you say, oh, I really hate walking. I don't like walking. I don't like, being outside. I mean, I noticed, I'm not from the UK, but I noticed that going out for a walk is the biggest pastime of British people, isn't it? Just go out for a walk. So maybe going out for a walk around the block is the physical activity of your choice. Sometimes it might be something different, and it's up to you. It might be sitting down to play with kids, for example, to play with your kids or your grandkids. So try to choose the activity that matters to you, and always remember, if you want to engage in any kind of physical activity, mobilizing physical energy, using, different positions rotations in your body, making sure that your muscles are there to support you. Try to make sure that you use the other P's that I talked about. Try to make sure that you're having breaks. Try to make sure that you rest. Try to make sure that you're going to sit down, have a drink to continue in the activity. So that's physical activity. And then sleep hygiene is the last bit of advice that I have to give you. And why is that? Because we normally use sleep as our normal way of restoring energy, right? That you probably used a lot before you were even diagnosed or had treatment. So sleeping is very important because it's the longest period of time where your body is restoring energy and it's really, really topping up, right? I normally say, when you go to sleep, you plug your phone in your charger as well. So your phone is there charging and it's time for you to charge. So how can you make sure that you're giving your body the best chance to restore energy? So normally I talk about sleep hygiene, which you're probably aware of all this, but sometimes it's really difficult to actually apply them to our day-to-day because life happens, because we're busy, because a lot of things are going on, because we don't live necessarily, not all of us live on our own and are able to apply all of these steps before bedtime. But try to make sure that you have a routine. So sleeping time and time to get out of bed. Try to just make it regular because your body is very, very clever and it will know that it's time for you to start winding down. Yes, so the timing is really important. Naps are something that most patients I talk to, they need some naps throughout the day to help restore their energy levels, and that's absolutely fine. But what we need to make sure is that you don't nap too close to bedtime because, of course, if that happens, it means that you're going to lie awake at night and you're not going to be able to go to bed. So normally I say after lunchtime, it's okay to have a nap, and I'm not going to advise how long you should have a nap for, but you will know if your nap is too long and it starts affecting your sleep when you go to bed at your normal bedtime, then there's a problem there. Then you might need to make that nap a little bit shorter. Unfortunately, there's no recipe for what you need to do or how long you should be having a nap for, or even if you need a nap at all. But if you feel tired and you feel like when you need to close your eyes, you need to have a bit of a rest, maybe try having a nap after lunchtime and try to go to bed at regular times as well. And just sleep hygiene. So before bedtime, try to be very aware of lights and all kinds of stimuli around you. So try to have a calm environment with calming activities. If that is reading for you, then fair enough. You can go and you can read something maybe with not using a lot of bright lights. If that is listening to music, If it's watching some program that is, relaxing for you, that might be it. What I normally say, and I try to alert for us to be careful with, is bright lights, especially white lights, so the lights that we normally have on our mobile phones that are very, very bright. That tends to tell your brain that it's daytime and you need to be awake. Yes? So one bit of tip that you can use is maybe set your phone for like night mode, so then the screen tends to be darker, or you can reduce the brightness on your screen so that the bright light doesn't tell your brain that you need to be awake. We often most people I talk to like to watch things before go to bed. So watch a bit of TV, put on some Netflix, or watch some programs or series. So that's absolutely fine. The only thing is, if you can watch a very violent movie or with thrilling contents and a lot of, a lot of shouts and guns and this and that, and if you find that relaxing, that's okay. You can continue doing that. However, I would say that most people find that some kinds of adventures and thrillers and horror movies, or, things that really capture your attention and leave you sort of, in a cliffhanger, they might be a little bit too anxiety-inducing, and that might cause some trouble for you to actually relax and fall asleep. So just be aware of that. Thrilling content, sudden noises, and bright lights. Too many explosions. I try to avoid that, but if you're fine with that, that's okay. Or if your partner's like that, or some other people in your house, maybe try to, take yourself away and do something that you find relaxing for you. I mean, this is probably all of you know that the more caffeine you have, the harder it is for you to get to sleep. But I particularly want to talk to you about caffeine because sometimes we're feeling so tired that we feel like that extra cup of coffee is going to make a difference during the day, right? That is fine. However, most of the medical advice that we have around the use or the ingestion of caffeine say that we would try to not have a lot of caffeine after lunchtime because that caffeine can stay in your system and actually disrupt your sleep at night. So just be parsimonious with the number of coffee cups that you have, and just try it yourself. Maybe if you have 3 coffees in the morning because you feel like you really need that to go through your day, but then you feel like your night of sleep is really disrupted, try playing a little bit with that. Try to introduce decaf coffee. Not all decaf coffee is completely zero in caffeine, so just be aware of that. Or try to have, some sort of caffeine-free alternatives. So that's important for us to consider. And balance with eating and drinking. Eating too much or too little close to bedtime, or drinking too much or too little close to bedtime can be detrimental to your sleep. So sometimes some patients find that they find a lot of comfort in eating a little bit more at night because they feel like, oh, actually that sends me to sleep a little bit more. And that's okay. There will be some variation to this advice, but I normally say the balance with eating and drinking is possibly what is the optimal alternative for us. We don't want to wake up during the night because we're hungry, and sometimes we have this problem because some patients say to me, I just really don't feel like eating anything, or my appetite has completely gone and I don't feel like eating anything, but then I wake up during the night and I'm super hungry and I need to have a snack. So try to balance, and everything is trial and error. You will try something today and it might not work the next day, but just try to make the small adjustments. Same thing for drinking. The amount of reports that I have that, I normally sleep really well, but I always wake up at 3-4 o'clock in the morning to go to the toilet because you had that cup of tea before bedtime. So just try to be mindful of that. So try not to drink, maybe just make half a cup of tea and see how you go, and see if that makes you last throughout a whole night of sleep without waking up to go to the loo. Okay, so this is some options for sleep hygiene. And then just to recap, the take-home message is try to remember or look up in your notes the 5 P's for energy conservation. So planning the activities, prioritize what's negotiable, non-negotiable, what's most important. Pace yourself. You don't need to do anything rushing. You don't need to do everything today. You can and remember to have breaks. Remember to sit down, have a drink. And positioning is important. Remember to take a seat, find positions that can support your muscle groups a little bit better. Permission, ask for help. Remember that it's okay to ask for help. If you're worried about asking for help, think about what would you think about someone else asking for help? And you say, well, probably I would just help them. And then just to try to make you feel a little bit more comfortable asking for other people to assist you. And remember, use a little bit of physical activity. The amount of physical activity, the amount of minutes or the intensity is going to vary from person to person. There's no prescription for that, but just some activity that uses physical energy throughout your day. And sleep hygiene. Try to keep those bits of advice with you and try to apply them in your day-to-day.